Hello, fellow acupuncturists. I'm Dr. Michael Corradino, the president and founder of the Neuropuncture acupuncture system. So I want to take a moment here and have a nice conversation with you about the language we use in our clinical settings, in our professional settings. We are trained with an extensive emphasis on the pattern differentiation and zong fu diagnosis. And we have to understand, first, where does that come from? Why do we use it? Why is it important? And should we continue to use it? Is there anything better that we might be able to use to replace it so that we can be better clinicians? That's what it's all about. And that all has to do with our language. So when we're taught Chinese medicine, we are taught in two ways. I think we need to make adjustments. Okay. The first one is the pattern differentiation and the zong fu pattern diagnosis. Okay. I'm going to explain to why that's important, why that was so important, but why we need to make a shift now. And then two, the energetic model. A lot of us rely on that energetic model as a reference to use as a way to explain what we're doing to our patients. Now, I just really urge all of you, we have an online workshop in all of the platforms that you can watch on the history of acupuncture, on the historical timeline that I've put together. I've been working on that for many, many years, well over a decade, possibly 2 decades now. Now, listen, I know this could be a little uncomfortable for some of our practitioners to hear, but listen, we are here in neuropuncture to embrace everyone. Okay. And if we're going to unify this field and move it forward in the 21st century and galvanize it in the heart of mainstream, we have to all come together under one umbrella. What is that one umbrella? Neuroscience. Because regardless of the system you practice, regardless of any system that we study or that we see, auricular, scalp, body, it's all neuroscience. And that's what neuropuncture teaches. So in the neuropuncture, neurophysiological mechanisms, you will learn how acupuncture works, and you're going to learn the language, okay? The language, the proper words to use. So that's important there. There's something that I've learned that I've been working on for many, many years, and that's called neuro-linguistic programming, NLP. And what we do with neuro-linguistic programming is we think about what the words we are choosing to describe what we have in our mind to create the same picture in our recipient's mind that we're having a conversation with. So if we're talking to our patients or a healthcare provider and we're using terms like energy, meridians, yin and yang, blood, it's just deficiency, excess, no one's going to get it. And you have to understand that there are doctoral students and master students that still get confused with these terms. And our patients and our healthcare providers have zero training in that. So that's number one. The language is just too hard to translate for them to get a clear picture in their mind of what we're trying to explain to them, number one. Number two, where does that pattern differentiation even come from? And that zong fu diagnosis come from? Well, it comes from the Huangdi Jing. And that was very empirical changes in mental thought or medical thought, at that time. Very revolutionary thoughts. What were the revolutionary thoughts? And I make it plural because it was not isolated to China, right? We had ancient Greece as well, Hippocrates and Socrates, as well as the Huangdi Jing had big shifts in medical thought, which was to stop looking at superstition and look at the patient's mental health, internal organ health, and their relationship to the environment. Diet, exercise, right? All that has a played a role in health, not superstition. That was pattern differentiation. That's great. Got the physicians of 2,500 years ago, 2,000 years ago, to stop looking at shamanism, which predated all medicine before that, to look at the body and the environmental factors. That's great. Now we're in 21st century medical sciences. Now we know when a patient can't sleep at night and they're diagnosed with restless leg syndrome because their leg is just super achy and they can't rest because their leg is not letting their mind settle down. We now know through 21st century medical diagnostics that it has nothing to do with the leg. We do not treat the leg in restless leg syndrome. We treat the basal ganglia and the dopamine generic system of the brain because it's a sleep disorder. Just like phantom limb pain. If someone had a phantom limb pain, feeling that their arm was still there, we don't treat the invisible arm. No, that doesn't exist. What we're treating is the map that's been now neuroplastically maladaptively changed in the brain that's creating that sensation of the limb that's been damaged. Okay. So in neuropuncture, we don't do pattern differentiation. We don't talk about pattern differentiation. The patient comes into us with tinnitus. We want to find out not if it gets worse at night. It's always going to get worse at night, first of all, because things get quieter. So that's not a yin or yang or deficiency problem. It's just a matter of reality. That just happens. When we're quieter at night, things get louder. Okay. But what we want to know is what's causing that ringing. Is it the vestibular-cochlear nerve? Is it the cervical plexus or the auditory cortex? That's the pattern differentiation we want to know. So in neuropuncture, when a case comes in, the first thing we look at is what's the underlying neural root pathology, not pattern differentiation diagnosis. Why? Because we're going to create an acupuncture or neuropuncture node selection and attach a particular signature of electricity to it to correct that underlying neural root pathology. Because in neuropuncture, remember, neuropuncture is the only complete neuroscience acupuncture system that teaches you, the practitioner, how to neuromodulate their patient's nervous system back into health using electroacupuncture. Okay. So keeping that in mind, using that concept, then we should only be using 21st century medical terminology and sciences and apply that to our clinical practice. That being said, that's why we want to only use the words in 21st century medical terminology. So we are in the American and global medical society, guys. We are in that umbrella. So it's important that we use the same language everyone else uses. Why? So we can first understand each other, right? But we also want to be accepted, and we want to be able to articulate what it is we are seeing and what we're doing to our patients. And you should be able to get all of that in this platform. Okay. I hear that repeatedly from my practitioners I work with, that they have an easy time now sitting down with a surgeon discussing their neuropuncture prescription on what they're trying to do to their patient, explaining it in the neurosciences and the electrical sciences. And that's what you're going to learn in this platform. Okay. Now, I urge you to try to keep in mind and maintain those new terms you're learning. Okay. So you're going to hear prescription. That's the neuropuncture node selection or the acupuncture point selection. Remember, it's not really a point, right? They're neurovascular nodes. They're not invisible meridians. They're pathways, channels, and networks of arteries, veins, and nerves. That's what we're communicating with, and that's what we're manipulating. Okay. And then we have the acupuncture node, the pathways, and then chi. What's chi? Well, we have all webinars on the history of acupuncture I'd like you to watch that goes through a really nice evolution of medicine since ancient Egypt all the way to present day. And when you see the evolution of anatomical discoveries with the understanding of medicine and pathology, you'll see that that energetic model doesn't fit. It just really was a mistranslation by George Sully de Moran in the early 1900s. And it was recorded that he even said on, I think his deathbed or later on, that he made a mistake with that. And don't forget that Paul Unscholl, a great scholar of Chinese medicine and acupuncture, said that there is no resemblance between the Chinese kanji of qi and the Western term energy. Okay? So if scholars are telling us that doesn't fit, and if the guy that created that energetic model says that was a mistake, stop using that construct. It's neuroscience. I know this is going to be hard, maybe, or difficult for you to gravitate to, but once you do, you're going to love it. And you have to just put that lens on, because everything that we see that might have been termed chi or any other classical TCM kanji or character can be now translated in 21st century medical sciences. You just have to do the work. I did a lot of that for you. Everything's in the platform. You're going to see that. And just try to really learn that language, relearn this language. And then what I always urge to do is talk to your patients about it. talk to your patients about it, have a conversation with them. As you're needling them, you could talk about the local effect. You could talk to them about the type of needling you're doing, maybe intramuscular needling. You could talk about, the needle itself, right? We always want to use, 21st century terminology. So these are our very special acupuncture needles. They are sterile, microscopically round, filiform, solid, disposable. Think about the words I just said, neuro-linguistic programming, right? Choose your words carefully so that your patient or practitioner that you're speaking with is going to get the proper image you want them to gather from what you're trying to teach them. So when we use, when we're describing our needles, use the proper words. When we're describing our devices, yes, they are FDA approved for electroacupuncture. It creates a biphasic waveform, so there's no risk of electrolysis or no damage can occur with this device. Very safe, right? So I always encourage you guys to have conversations with your patients, not using any TCM jargon. Definitely don't put that in any of your reports. Definitely no medical reports. I wouldn't put that in your legal reports, insurance reports. Stick to Western 21st century medical terminology. It's not even Western. You can think of Western, but don't get caught up in that game. It's 21st century global medical terminology. Okay. Everyone will understand this. If I go to Israel and teach this, or China or Australia or Canada, I use 21st century medical terminology and everyone understands it. Okay. So that is very important. I would urge you to also study as much neurosciences as you can. Start to learn about your patient's pathology. Any patient that comes in, if they have a condition you don't know, write it down and do a quick Google search and write neuropathology afterwards. Once you see what's the cause of it, let's see if we can create an AcuNode prescription, or is there one already there in neuropuncture to correct that pathology. And that's the way that neuropuncture 21st century medical mindset works. And it needs to be trained. So when patients come in now, your first mode of thought should be, what's that underlying root? Because that's what you have to correct. It's not pattern, right? You have to remember that, okay? Those transmissions sometimes do cross over with patterns, but that's for another discussion. But for right now, when it comes to language and communication, you want to keep that TCM jargon just for us communicating amongst practitioners and with any other healthcare provider, and definitely any physician or patients. Definitely stick to 21st century medical terminology. Okay. And remember, acupuncture, all acupuncture is neuroscience. So the better you can understand that, the better you're going to be able to communicate that and grow your practice and better treat your patients. So if you have any questions on any of this, please feel free to email me. We have webinars throughout the platform. In all memberships, we have the history that you can watch. In the gold, we have several webinars on the 21st century medical mindset. And then we have a couple extra ones also on the history of health, history of acupuncture as well. And if you would ever like to catch up with me, you're a member, you have access to me, please shoot me an email. Love to catch up with you and have a discussion about this. This is a big, important movement in our profession. And we are all have to do this together in order to have acupuncture survive. We have to use 21st century medical sciences and examine it under 21st century medical sciences. Okay, have a great day. Enjoy the platform. Let me know if I can help you with anything. Take care. Bye-bye.